Hey everybody, hi. Hello to everyone. So, today I am going to tell you about like a basic stuff about when you go to a doctor, what all questions they ask and why they ask. And you know that I've already told that. So, I just wanted to tell a couple of things, okay? Now, wherever you go, okay, the hospital's name, everything on will be on the side, okay? So, the first thing would be name, obviously, name, okay, and the next thing, age, which is very important to a doctor, because if it is like young or 20 to 30 or 30 to 40 or 60 to 80, whatever it is, it's kind of very important for age, because there could be problems related to age, okay. And the next thing is address, okay, your home of address will be much better, because they need to know about how much distance you travel, or where you're, how do you work and everything. So next comes is job. What kind of job do you do? Because your job is related to your problems. Like if it is IT, the neck problems. If it is like if it's a teacher, then probably varicose vein problems and stuff like that, okay. The next thing is like obviously marital status, which is not much important, but still it is part of something. Like already you'll be taking their husband or whoever it is, and how many kids do you have. And you, along with this, I think it's better if you tell the doctor if you have gone through like one delivery, two delivery, cesarean, normal delivery. It's kind of important, and this is important to both allopathic and ayurvedic doctors, okay, not just them. Next thing is your problems, okay. So I'm gonna write your symptoms, like whatever things you have gone through here, whatever it is. Now here you can write like whatever in your own language, okay, your own language. You are not supposed to use medical terms here, because this is in your own basic language, your native Malayalam or Telugu or Kannada, whichever language you want. The doctor should not write this. You are supposed to write this, okay? If it is headache, or like for example, I'm going to write here neck pain, and I have a little bit, since I know the word, I can write stiffness, okay? If you know the word, it's fine. Stiffness, leg pain. Maybe this is the only thing you have, and then leave it to the doctor, okay. Yeah, so here symptoms, whatever things you feel. The next comes is whether you have done any operations, okay. Every operation is important, whether it's in your childhood or whatever, ligament tear or angioplasty, any medicines you're taking, whatever it is, okay. So right, operations department, maybe they don't have the department, so you can just add it up there, okay. Next one is history of any fall or accident. HO means history, okay? History of fall or accident or whatever has happened. If anything has happened before in your past, in your childhood, college days, whatever it is, okay? Now, the next comes is the most common, which everybody writes: diabetes, cholesterol. These are short forms I'm writing. If anybody has any doubt, they can ask me. Blood pressure, if it is high, you can write hypertension. If you don't know that, it's okay, you can just write like this: BP, high or low, whichever it is. And if you have any like fatty liver or something, you can write here fatty liver. And along with this, some people might have like a little bit shy. They might be going through some anxiety, so you can write anxiety here, anxiety, stress. You can also write sexual related problems, like that, okay. Sexual issues, you can write like this: issues, okay. So this is the call. This is what I prefer if a person is coming to me. And if there is like a form, everybody would have a form in any hospital. This will be much important to them, okay. Now the next department would be like, after all this, obviously some people would have a signature there, like you have to sign in that form, or it depends on each hospitals, okay. The next department is whether you're taking any medicines, okay. Ayurvedic medicine, allopathic medicine, medication is really, really important, okay. So whichever medicine it is, you can write the name here, and any reports, x-ray, whatever they say, okay, like L4, L5, dislocation, disc bulge, whatever they have said, you can note it down there. So after seeing this, almost we, a doctor, can realize what all things they have, what all issues they have gone through, okay. Last but not the least, the doctor would tell you the diagnosis. Now, this department will be in every little small piece of paper. Diagnosis. Okay? So, an allopathy doctor would write allopathic diagnosis. We write something like this. Okay? So, if it is like, for example, any joint related, it could be Sandhigata Vadam, which means joint pain. Okay? Vadarakta gout. Okay? Which means gout. Okay, now if it is cough, then kasa, like that. Okay, so the Ayurvedic doctors would write Ayurvedic terms here, but not necessary because things have changed a lot. I mean, we have changed. Okay, so this is an overall review or overall idea about how much information a patient gives to a doctor. Okay, if you have any doubt, you can ask me. And yeah, so I'm gonna write here, and people write their names and they put their signature. So yeah, I've written my name here. Yeah, so after this, you can, the doctor sign you can see. And yep, bye bye.